Well, according to a new study, the vaccine to treat the shingles virus could reduce the risk of dementia by 20%. More than 280,000 people in Wales were involved in the study by a Stanford University team. Joining us now live from California is lead researcher and assistant professor of medicine at Stanford University, Pascal Geldsetzer. Pascal, sir, thanks so much for your time. We appreciate it. What made you want to investigate this link between the shingles vaccination and dementia in the first place?
Well, yes, there's been increasing evidence that viruses that preferentially target your nervous system and may remain hibernated in your nervous system, like the chickenpox virus, may be implicated in the development of dementia. And there's also this increasing body of evidence that vaccines have broader effects on the immune system beyond the specific antibody response that they have been designed to elicit, and that these broader immune mechanisms may have benefits for chronic diseases, including dementia.
So tell us a bit more about the study and what makes it so unique.
Well, ideally, what we want in clinical medicine to show that a new vaccine or new medication works is a randomized clinical trial, right? So we take, say, 1,000 study participants, and then we throw a coin to assign them to either receive the vaccine or no vaccine. And the power of this is that we have really good comparison groups because we know that all that's different between them is whether the coin landed on heads or tails. In Wales, we had this really unique opportunity to look at the effect of shingles vaccination on dementia in a situation that was very similar to such a randomized clinical trial. So they said, if you had your 80th birthday just prior to the start date of the program, the shingles vaccination program, you were ineligible and you remained ineligible for life for the vaccine. But you had it just after, you were eligible. And so we see that just a 1 week's difference in age across this cutoff means that your probability of ever getting the vaccine suddenly jumps from 0% to 50%. And so again, we've got really good comparison groups because all that's different between them is whether they were born just a little bit earlier, just a few days earlier, or a few days later. And that's what makes our study so powerful and our results so exciting, because we really are able to get here at cause and effect rather than just correlation.
So the implications of this, I mean, this could be huge.
Absolutely. So we find that over a 7-year follow-up period, 20% of new dementia diagnoses are reverted through shingles vaccination, which is much larger of an effect than any of the pharmacological tools we have. And it's a readily available, inexpensive intervention that is known to be safe and has additional benefits, right? It's also prevents shingles, which is an added bonus, if at all. So yeah, it would have huge implications for population health and dementia care.
So for people watching this interview at home, after you've been poring over this research, the data as part of your study, what would you be saying to them about whether they should be heading out and getting that shingles vaccine ASAP, and what sort of research is needed next to prove that this would be beneficial?
Well, we know that shingles vaccination is recommended for older adults because it prevents shingles. So this additional dementia benefit is only an additional reason to get vaccinated, I think. But certainly what I think we will really need to convince the public health and medical community that this is a true causal effect is a randomized clinical trial. And that's what I'm currently trying to raise funds for from philanthropy and private foundations to run a randomized clinical trial on the effect of shingles vaccination on dementia and cognition using the old shingles vaccine, the live attenuated vaccine, which is the vaccine for which we have generated this compelling body of evidence from our national experiments in Wales and in other places.
Pascal, best of luck with the research as you continue on. Really appreciate you bringing us up to date on the findings. Thank you.
Thank you so much. Thanks for having me.